Hi everybody, welcome to Real Talk Med School. My name is Frishta Saifi and I'm a first-year medical student at Hackensack Meridian School of Medicine. Real Talk Med School is a podcast dedicating to showcasing the real lives of med students, the good, the bad, and the ugly parts of med school, and having conversations on tough topics that no one seems to really want to talk about. This idea came about when I was speaking to my mentee and realized that she had the same questions that many people before her have asked, such as what if I'm too old for med school? What will happen with my relationships with family and friends now that I am studying so much? And what happens if I fail a class? So this got me thinking it would be nice to interview some of my classmates and ask them these types of questions so that they can hopefully provide advice and guidance to whoever needs it. This first video is dedicated to learning about Hackensack Meridian's accelerated curriculum and some key points about it. So I hope you enjoyed this first video and look forward for more to come. Hi, I'm Farishta Saifi,
And I'm Boris Salazar.
and we're both medical students at Hackensack Meridian School of Medicine. So today we want to just give a clear image on what Hackensack Meridian is as a school, the curriculum, and how we kind of were able to navigate being med students.
Yeah, and in general, it's also just to help answer any questions that you guys might have, any questions that we had when, making our decisions to choose a medical school. So hopefully this will help.
Mm, okay. So the first question is, what drew you to Hackensack Meridian?
Ooh, well, for me, I like Jersey. I wanted to stay local so I could stay close to my family, and yeah, I like living in Jersey, being close to New York City and Philadelphia, and also the shore. So I definitely wanted to stay in the tri-state area. And in terms of the school specifically, I really like the P3R program. I'm personally interested in general surgery, and unless that changes, the P3R program would help me go into that residency a year early. And as I mentioned, I do like Jersey, so I don't mind staying within the Hackensack network, which is like very familiar and also the biggest in New Jersey. So I would get a lot of good experience, and also it would save me a lot of time, and I would get to learn, the field of my dreams just that much earlier.
Mhm. Yeah, for me, it was very similar. I'm from Brooklyn, so I applied all throughout the tri state area only. I knew I didn't want to go too far away from my family. And so Hackensack is located in Clifton, New Jersey, which is about like 45, 10-hour long drive away from Brooklyn. So I'm able to commute back and forth on the weekends to go and see my family. And also, the P3R program for me was really important because I am a non traditional student and I am 27 years old. So I kind of already know what I want to do. And so being able to do the P3R program and I guess like save that time of doing like the match applications and things like that was like really important and something that drew me into Hackensack.
And a whole year of tuition too.
Mm-hmm.
Hmm. All right. So number two, what was the biggest challenge in transitioning to medical school, and how did you overcome it? And then thirdly, in hindsight, what would you have done differently, knowing what you know now?
So I think Hackensack does like a really good job at helping us transition from student to medical student. During the first 2 weeks of orientation, we have something called HDIO where we're getting familiar with the curriculum, with the professors and our classmates. So I guess like the biggest challenge that I would say was finding I guess like for me, it's like really important that I have support, being non-traditional and everything, and also first gen. And so for me, it was like kind of like difficult to see like, okay, who is like my village, like who is like my community, the people that I can lean on. But I was able to overcome that by joining clubs and also just putting myself out there and meeting different people. And then eventually, I was able to see like who my fellow classmates were and also who um, were like really supportive from the staff side as well, and like just kind of made that into my little village. And then I guess like in hindsight, um, uh, I don't know if I would necessarily change anything. I think I did it in like the correct way to like join all these clubs, and then you're kind of like bounded with these people in that type of way. Um, yeah.
Yeah, I think for me, the most difficult thing about that transition was just adapting to really the amount of material that we had to learn every day.
Mm.
Um, it really is a lot. It really is like what how they say it in terms of trying to drink water out of a fire hose. It's a unique experience that you can't really understand what it's like until you do it. So for me, what I would have done differently is that I would have tried to spend less time focusing on every single little piece of work that we had to do, and I would have tried to get the bigger picture of all the material that we were understanding instead of trying to memorize and understand and memorize every single little detail. Because one of the things that we learn now and we realize now is that nobody can learn every single detail, that from every lecture all throughout medical school. It really is about understanding the bigger picture, and then as you gain more experience, the little details will come, into memory over time. So I think, yeah, I think just not being so worried about every single little thing is probably what I would have changed.
Mm. And then yeah, I guess like just to add to that, also being more open to like using the resources from the school because the upperclassmen did put together a very nice drive that's filled with like resources such as like bootcamp.com and sketchy.com's
Mm-hmm.
um, videos and things like that. And also the Anki drive as well. Like I wish that I was more open to it in the beginning, but now that I am, I'm seeing how helpful it is.
Yeah. Then maybe another thing is that I wish I would have been open to utilizing some of those resources, because I just try to stick to what the school was giving us,
Mm,
and was kind of afraid of using third party resources because I wasn't sure if all the material would line up.
same.
But then I started realizing that all medical education is going to be the same no matter where you go, no matter what resource you utilize. So as long as you match up the content by the topic, you're going to get the main thing, the same information. Except that if it's something on like boot camp or sketchy, you're going to get more of like the high yield information, that's going to be tested on boards and whatnot. So not all of it might apply. All of it might not apply to your like in school exams, but most of it will. And then you could just fill in the gaps by reviewing lectures and whatnot.
Right. And then what's like not, I guess, so high yield for this exam, it's still like going to show up, potentially show up in your step.
Yeah,
So it is important, like if not for now, then in the future.
exactly.
So can you describe about the week to week basis of our medical education?
A typical week for us is usually lectures, on every day except for Wednesdays. On Wednesdays, we usually have um, a biweekly rotation of clinical skills or the human dimensions. So, starting off with clinical skills, that's typically in the early phase of medical school. That's where we start learning, how to interview a patient, like what questions to ask, how to communicate with patients with using empathy and like patient centered communication skills. And then now, as we're progressing, we're learning more like actual, skills, um, how to use a stethoscope, how to auscultate, using other devices like to check the eyes, the ears, and whatnot. So it's definitely a lot more fun as you go on. And so again, we just have that every other Wednesday of clinical skills, and then in between that, we'll have human dimensions, which is really sort of like the heart of the school, because part of our mission is just very community focused. So in human dimensions, one of the like the standout parts of it that really shows the community service aspect of it is that we're partnered with somebody in the community. It's usually one person. Sometimes it can be like a partner, like a couple or something. But basically, we're partnered with them in order to sort of be their health coaches. So we get to meet these people and sort of give them, should track their health along and help them on any health goals that they might have. For example, like dieting, trying to lose weight, seeing doctor's appointments, getting health insurance. We're basically going to be their health coaches for the next 3 years. And so we really get to grow with them and learn all aspects about them, also like including their mental health and well-being and whatnot. So that's one of the things that we do longitudinally. And then another aspect of our curriculum is health system science. So those are integrated as part of our normal lectures, and that's really where we get to learn basically how like the healthcare system in the U.S. works. But then also other aspects like how do doctors go about making decisions on like a diagnosis, like how do you rank different symptoms and how do you utilize those symptoms to get to a diagnosis, right? Like you can assign values to different symptoms um, depending on like positive likelihood ratios and whatnot. But you'll learn that when you get here.
And so, just to add on to what Boris was talking about with the HD program, we are paired with somebody, and that's called our VP, which is called
Voices partner.
Voices Partner. And so, like for an example, my VP, she's an elderly woman who doesn't have health insurance right now. So I'm working with her to try and get her health insurance so that she has better healthcare access. Can you talk a little bit about your VP?
Okay, yeah. So for my VP, she's a woman in her late 50s who has like a long history of mental health issues. So those are the main things that she deals with, and so we just try to, more so just be like an open ear for her to vent any struggles or issues that she's dealing with, and then occasionally she will ask us to help her like set up a doctor's appointment and whatnot, and also we are able to go with our VPs to their doctor's appointments in case they have any questions during the doctor's appointments that we might be able to help with, since we're going to get to know them a little bit better than some of their doctors, since we're going to be spending 3 years with them. So that's also a possibility. I personally
Actually,
haven't had
yeah, I
done
didn't
that
even
yet.
know that you could do that.
But yeah, we can. So it's like we have an agreement that we do with them that outlines what we can and can't do. So, for example, one of the things that we can't do is give them medical advice because we're not physicians yet.
Mm-hmm.
But we are able to, be there with them every step of the way as their health progresses, or unfortunately, sometimes declines.
Mm-hmm. And then also, it's important to note that it's not so much that there is like protected time for us to do this, but it doesn't really interfere with our curriculum because that's something that a lot of people ask me about. Like, okay, so we have the HD curriculum, which is like unique to Hackensack. How does that affect your studying? And honestly, it really doesn't. We only meet with our VP once a month, and it's only for an hour. So it really doesn't affect my studying at all.
Yeah, it's really not too bad, and the assignments are just write ups, which are like summaries about what happened during the visit,
Mm-hmm.
anything new, any changes, and yeah, so it's really not too bad. But also, I should mention that like a big focus of this and the big purpose of this is to really understand the social determinants of health and other determinants of health that really impacts a patient's health to decline or improve over time, because a lot of what impacts a patient happens outside of the hospital. And then I should also mention another big aspect of our curriculum is something called 3PC, which is an acronym within an acronym. So it's like patient presentation,
Mm-hmm.
um,
Something,
case.
yeah.
Yeah, we don't even know the acronym. But the point is that we're going to have two sessions every week. One is going to be on Monday, and then one's going to be on Friday. So I actually think that this is my favorite part of the curriculum, because on Monday you're going to be in a small group of about 8 people, and you're going to be given a case of like a standard patient, and it's going to give you all their information, like why they're visiting the office, their what issues they're having, what symptoms, their past medical history, family history, basically everything about them. And we're going to have absolutely no idea what's going on because we haven't learned anything yet. But the cool thing about it is that all of the lectures during that week are going to give us all the information that we're going to need to solve that case, so that when we meet on Friday again, we're going to be able to discuss the case with all the pertinent knowledge that we need. And also, what's really cool about it is that on Fridays, our group is going to also include a physician who is going to be our facilitator for a long time. So they're going to get to know us very well and also give us personal help, to sort of fill in the knowledge gaps. And I think it's a very cool way of learning because you're able to apply all that information that you gain throughout the week into a real life case. And usually these cases are like of things that are very commonly seen in the hospitals. So I think it's a very good way to like stick the information.
Yeah, it's really helpful because you get to learn like off of your classmates. So like in the group, like Boris had said, you're basically not supposed to know what's going on with this patient, but a lot of like your classmates will just because of their prior experiences, maybe like family, friends, or even like their past jobs, such as like EMT or a medic. But it's okay if you don't know anything because, like Boris had said, you're going to learn that information throughout the week. And then on Fridays, two of those eight people are going to present research on that. And I think it's like a really good practice for when we're actually in clinic and we're doing rounds to like get your confidence up and then know like how to present like the important parts of a patient's case and then taking out all the fluff.
Yeah, yeah, that's another huge part. And I'll reiterate that there is going to be a physician there serving as your facilitator every single Friday. So you really get that one on one, well, not one on one, but you get more of that personalized help. And
Yeah.
that starts in the very first week of medical school. So during that first week, I remember like, I haven't even learned anything. How am I supposed to even solve a case?
Mm.
But you really get to appreciate the, sort of the purpose of 3PC and that it's not just about learn. We're not here to just learn all this information, but we need to utilize it. So it helps us, take that second level of understanding of that information and learning how to apply it.
So our curriculum is a little bit different too from like majority of medical schools, whereas like other medical schools usually have like I think a test like after each week, whereas
Yeah,
ours is
like
like
after 2 or 3 weeks or something.
yeah, whereas ours is like at the end of each block. And so how we track our progress with like the information is that we get weekly formatives, which don't count towards our grades, but just for us to know like where we're missing concept gaps in. And then also we have TBLs that do count towards our grade. And basically what happens is that you take the test by yourself and then you take it as a group with other people. And then that combined grade is what you end up with. And so it's not so bad, right? So even if, let's say, you get a 5 out of 10, if your group gets a 10 out of 10, that's going to bring up your score.
Yeah, and TBL means team-based learning,
Mm-hmm.
and so that's why not only do we take those quizzes by ourselves, but then we also take it as a team. And the main purpose of it is to, come together at the end of the week, to really fill in any content gaps that we have, and so we utilize each other to fill in those gaps.
Mm-hmm.
And then after those quizzes that we have, the team-based learning quizzes, then the rest of that class is followed up by, extra questions that are going to help us, apply more of the information that we've learned during the lectures from that week.
Now we're up to the stage of medical school where we're doing something called LCP. And could you tell me a little bit about that?
Yeah, so all of the things, the aspects of our curriculum that we mentioned previously, all that started week one. Now, the thing about medical school is that shit gets hard real quick, right? So like as soon I remember, I think the both of us were talking about this
Mm-hmm.
before, but around we started school last August, and around January, that's when we started to feel more comfortable. Like okay, we have our routines down, we know what we need to do every single day to get the good grades and whatnot, and actually learn this information, which is a lot. And then out of nowhere, they add on what's called LCP, which is, I believe it stands for Longitudinal Clinical Preceptorship.
Mm-hmm.
And basically, what it is that for the between January and September, we're going to be placed at a local like community clinic. It could also be like a private clinic, or some people get placed in a hospital, and we're going to be placed with a preceptor. And it could be for any field. For example, with me, I'm placed with a
Geriatric.
geriatric physician. And the whole purpose of LCP is to get real world experience, and you get to utilize the information that you're learning in lectures and also in clinical skills, and you get to practice that with patients. Obviously, a physician is going to be with you that entire time, but it's so important because you get that. In this case, it actually is one-on-one feedback from a physician, and it's not just learning all this information and then practicing it on a standardized patient, which are paid actors, in our school. But now we're actually utilizing this information to diagnose patients early on. And I think that's very unique because a lot of medical schools don't give you medical, like real world exposure until like after your second year. But here we're already getting it like after, like 5 months in or something
Yeah.
like that.
And actually, we forgot to mention that during clinical skills, you're also going to be tested on that as well during the end of the block, and it's called like an OSCE. And so basically, what you're going to be doing is that we're going to be learning all this information from clinical skills and then applying it during an OSCE to a standardized patient, which is just basically an actor or an actress acting as a patient. And then we get feedback and we get graded on that as well. And then from there, and now since we're almost to the end of the first year of medical school, now we're put into clinic through the LCP program, and we're using what we learned in OSCEs in on real patients. And so actually, I was able to diagnose a patient with asthma recently because during LCP, you're required to take a history of a patient and possibly perform a physical exam if needed. And so I did that, and I was able to tell the doctor that I believe that this patient has asthma, and the doctor had told me that yeah, that they confirmed that that was the true diagnosis.
Yeah, and so this is also very important because we're going to be starting our clinical rotations around November, December.
Mm-hmm.
So it's a really good way to start to get that experience to be more comfortable, working with real patients, but then also doing other things like taking a history, doing physical exam, and doing presentations to a physician or an attending, whatever resident attending, whoever it may be. And just overall getting more comfortable working in a hospital environment or clinical environment overall.
Mm-hmm. So now that you know a little bit about the curriculum, I wanted to actually talk about some tips for studying, and then also if you could talk about the pass-fail curriculum that we have here.
Yeah, so I'll start off with the pass fail. Pass fail is great. You should definitely go with a pass fail school because
Mm-hmm.
I've heard horror stories from other schools that aren't pass fail. And you don't want that. So benefits of pass fail is that it definitely creates a more cohesive environment, collaborative environment, as is the case with our cohort. There's usually a lot of people that are willing to share resources. There's actually this one girl in our group chat that sends like weekly deadline reminders, which have really saved me a couple of times. So
Mm-hmm.
I find that very helpful, and like nobody pays her to do that, so I find it great.
Yeah, the pass-fail curriculum
Uh-huh.
like helps with like the culture of the
Oh, and
school,
then
which we'll
study how to
get
study.
into
Yeah.
a little bit more later. But
Mhm.
yeah, so give them some tips on how we've been studying.
Yeah. So in terms of studying, where I'm at right now, I'll just mention that it changes from course to course. But what I'm doing now is that I'll have lectures from like 8 to 1 p.m. or something, and then I'll go home, and then I'll probably run. Yeah, I'll do like the Anki cards for the lectures that we had that day, and then I'll also try to do Anki cards for last week's material, and so that way I can keep studying all the material that we've been learning throughout the entire course. And I'll just do that every day, and then at the end of the week, my goal is to do some practice questions from like outside resources for the material that we've learned that week. I'm not like fully there yet, but that's the ideal plan. That's what I'm working towards. And then also another thing to mention is that we use this resource called Bootcamp, and you can use any resource, but we use it to watch videos about the topics that we're going to be learning the following day. So usually the school provides us pre-work, but it's usually like a lot of textbook chapters, and nobody has time to read all that. So we usually just watch the related videos on any outside resource, and so that way it primes our brains to the information that we're going to be learning. That way we're not fighting for our lives to try to understand the information because the pace of some lectures can be super fast.
Mm-hmm. Yeah, and I just wanted to talk about like so the benefits of like a pass fail curriculum too is that medical school is gonna get hard and life doesn't stop right outside of medical school. And so let's say like you did really well on like one block, and that's because you were able to put in your all to that. But then the next block maybe something happened in your life where it kind of like took a hit to your studying. At least you have the pass fail curriculum so that let's say Boris was to get like a 70 and I was to get like a 95,
Never
we
happens.
would still be passing together. We'll still just have a P on our transcript, so it doesn't really matter. And then you're able to just kind of like learn that material later on.
Yeah, absolutely. So it definitely serves as a good buffer.
Mm-hmm.
And some people have the misconception that like if you go to a pass fail school, no one's really going to be trying, their best to like learning the information. But that's absolutely not true. Everyone that gets into medical
Because we still
school,
have to know the information for steps. So
exactly. Don't get me wrong. There are definitely like it's like a minority of people that just like
do enough just
pass
to pass.
by.
Yeah.
But I mean, to each their own. At the end of the
Yeah.
day, this information is going to help us save lives.
And we're also going to be able to see it again in clinic, where it's like more relevant and like more prominent to like remember it. But yeah, I mean, I feel like me and Boris, like we're always like in competition with each other. So that's pretty good sometimes because of the fact that we're able to push each other. So like, yeah, I'm trying to get like 1 point higher than
Never
him.
happens.
Yeah, actually, it happened this block, but
We don't have to talk about that.
okay.
Anyways.
Anyways, oh yeah. So some tips for studying. Um, like I had mentioned before, the upperclassmen did a great job at making these like resources that are that you're supposed to pay for free and available to us. So that's really like helpful. And we also have tutoring services here once a week as well. That's offered by the school for free, and that's run by upperclassmen, people who already took the test, people who are already familiar with the material. So they like drop a lot of gems for us to know what's high yield and what's not. And also, it's just somebody who you can use as a mentor as well.
Yeah, and I highly recommend uterine, using uterine, using tutoring services, even if you don't feel like you're even if you don't feel like you're struggling, because that was one of my mistakes in college. In undergrad, I never utilized tutoring resources because I felt like, okay, then that means that I don't know anything. But
Mm-hmm.
no, even if you feel like you know what you're doing, you should still utilize them, because the way that it works here at the school is that all the tutoring will be for all of the material that you learned the week before. So it's also a really good way to make sure that you're keeping up with previously learned material while you're still learning your new material. It just serves as a really good like an hour and a half, time to just go over, summarize literally everything. And usually the tutors will pull out, because they're upperclassmen. They know what's like actually important to learn, and focus on. So they'll tell us that, they'll give us the hints. Yeah, that's why I like it too.
Yeah, and they also give us the hints on like what's going to show up a lot in clinic too. So that's like really good. So for example, right now we're doing the cardio block, and I wasn't so sure if we should know how to read an entire EKG, but the upperclassman that's my tutor had told me, yeah, it might not be relevant for your exam, but it's going to be super relevant in clinic. So I'm like, okay, let me learn it now, or at least like majority of it now, so that I'm good for when we move on to clinic in December of this year. Okay.
Ooh, also, not a study tip per se, but a good piece of advice for medical school, but also life in general, is that don't compare yourself to others. Um, you're gonna find real quick that everyone has their own techniques that works for them, and there's so many resources, so many third-party resources, so many different study techniques.
Mm-hmm.
Just find something that works for you and stick to that. Also, you should also be adaptable, because different courses require different study
I
techniques.
agree.
So for example,
Mm-hmm.
learning anatomy is completely different than learning how to read EKGs, or like
Mm-hmm.
pathophysiology of diseases, or yeah, whatever. So the point is, so be adaptable, but
Mm-hmm.
don't think that don't think that you're not doing enough because somebody else is utilizing a different technique.
That's actually something that I emphasized within my interview here at Hackensack was like I got questioned about I got a few D's like on my transcript, and I got questioned on like how I was able to bring up my grade, and that was just by realizing that every single class is you can't use like the same study habits for every single class. And so basically I realized that for anatomy like flashcards are great, but for like biology, using third party resources such as Sketchy or like Picmonic was like better. We spoke a little bit about study habits and different like study methods, but what about like work life balance? Like, so our curriculum is a 3 year program and it's accelerated, and a lot of people ask me like, hey, medical school is hard enough, like how do you deal with the accelerated program?
Yeah, one of the things that really helped my state of mind coming into medical school, because I was worried about the exact same thing. But on the very first week, that they told us that it's not really so much that we're learning more and like at a faster pace. It's just that we get less breaks. That's what it comes down to. So we'll get shorter winter breaks, shorter summer breaks. That way we could just learn more of the information, but we learn it at the same pace as other people. And so that can come, that can. Let me start that part again. So we
I
could
feel
keep
like
that first
the way
part. I
that
was gonna say,
yeah, the way that I explained it to like somebody was like we just take out like all the fluff or whatever. So like Boz Camp says about the Krebs cycle. I'll say that.
okay. Oh yeah, because like some schools have like specific genetics class, specific like biology class and
Yeah.
whatnot. So
And so to add on to what Boris was saying, also the fact that like our school takes out like a lot of the fluff. Like there are some medical schools that are still teaching things that are not clinically relevant, and that you're never going to see in clinic. For example, Dean Boskamp loves to say that we don't have to learn the Krebs cycle. I mean, we do have to know like the important steps of it, but we don't have to learn the entire thing in depth. Whereas some medical schools are still requiring students to know the entire thing. We really just have to know the main key portions of it and also why it's clinically relevant. Um,
yeah, and then one going back to like the pacing of everything. So again, like we still learn everything at the same rate. It's just that we get less breaks. The only drawback of that is that like we'll have an exam on Friday and then we'll start the new block on Monday. So
yeah.
sometimes it could get a little bit overwhelming. So I guess that is one drawback, just to keep it real. But I mean, we've done okay so far. I like definitely make sure to utilize your breaks
Hmm.
and like don't do any studying. If you have a break, like actually do something fun or
Yeah.
just rest.
And then what about like work life balance throughout the blocks?
Yeah. So for example, we typically have what is it, like 8 week or 12 week blocks.
Yeah.
So right now we're on a 12 week block, and usually the way that I think about it now is that I'll spend the first few weeks and I'll take it a little lighter on the weekends. So for example, on a 12 week block, maybe the first 4 or 5 weeks, I'll just do most of my studying during the weekdays,
Mm.
and then do like minimal review on the weekends, and just really leave that time for myself. But then during the second half of the block, that's when I'll start to use more time during the weekends to do more review of the previous week's material, and really like start to prepare myself for that final exam.
Hmm.
And work life balance overall, it's definitely doable, guys. Like I thought, if you think that you're gonna have no life in medical school, you're partially correct. Around exam time, that's very much true, but it's definitely doable. Some people, I know some people that like don't study past like 5 or 6 p.m. because that's one of their personal rules. It
Hmm.
really comes down to how efficient you can be with your time. There are people that like study all day every day, but that's probably because they're not using their time efficiently.
Hmm. Yeah, and then I think it's also just important to note that, like how we were saying, for different topics, you're gonna have to study differently. So my piece of advice would be to like use the first 2 weeks to really learn how to study for that block, and then you can pick up on like your hobbies again and things like that. I'm not saying to like completely drop your hobbies, but I think that for at least like maybe the first 2 weeks, just to be like, okay, how can I study for this block efficiently? And then where can I work in what I love to do outside of medical school, like something creative or something like sporty, like within that the rest of the weeks.
Yeah, no, I really like that. I think it also goes to like a bigger picture of like every block is a new start. It's a
Mm,
fresh start, right? So,
yeah.
for example, I had a my hardest block was our immunology one. I think that's no, I still did well, but it's definitely like the worst one of all the classes that I
Mm-hmm.
had. So I really took the time on the next block to really hone in like how I wanted to approach this new block, what I wanted to do differently from the previous one. And yeah, it's just a general good reset.
Mm-hmm. And then finally, I wanted to talk a little bit about the school culture.
Yeah, yeah. I touched on it a little bit earlier. I think it's very collaborative, very nice. Um, there's really not too many people that you're gonna find here that cause any troubles or whatnot. There's, I mentioned, people are willing to share resources no matter what. No one's gonna hide anything from you. Obviously, no matter where you go, there's gonna be gunners.
Which is not necessarily a bad thing. Like a gunner, I think to me is just somebody who like really wants to master the craft of medicine, which is like
Yeah,
kudos to them. But it's
yeah,
not because we're pass fail. It's really not going to make or break if you're a gunner or not.
exactly right. I mean, it's kind of crazy, but it also really comes down to like, yeah, people want to should do the best for themselves, but are they going to do it at the expense of others? Are they going to put
Yeah.
other people down to lift themselves up? That's what I actually think a gunner is.
Hmm.
So no matter where you go, you're going to find people like that, but I can't count more than a few in our class.
Hmm.
But anyways, let's keep it real talk. There's also going to be, and no matter where you go, there's going to be people that cause drama, but you just got to surround yourself with the people that you want to be around. Don't cause a lot of drama. And yeah, I
Yeah.
think in general, it's a small minority in our cohort, but yeah, like 98% of the people, don't cause any issues.
And our class size is small, which is something that also drew me into the school because, like I said before, I'm non-traditional and I'm first gen, so it was important that I recognize that a smaller class size is what works best for me because you get that one-on-one time with the professors, and then also your class, you get to be very close with your classmates. So that was important to me. And I think that I'm able to do that efficiently while staying out of the drama as well because of the fact that like we pay so much money to come to medical school. I'm not here for drama. Like I'm here to learn, and all that other stuff is not what I paid for. So I think that like just having that type of mindset like really helps.
Yeah, it's kind of crazy. Medical school surprisingly can seem a lot like middle school at times.
Mm-hmm.
You'd be surprised, and yeah, I think pass fail probably does help with that because
For
I
sure.
can I can imagine people would only be much more annoying if it was like graded curriculum and whatnot.
Yeah.
The stress level would just be higher overall.
Mm-hmm.
And then also aside from just our cohort, our faculty are really the vast majority of them are very lovely, very helpful. And really willing to take people on to shadow and whatnot. Like for example, she wants to be a I get you could tell.
I want to be an interventional cardiologist.
Mm-hmm.
And so, because right now we're doing the cardio block, there's a lot of cardiologists coming in and teaching us. And so, after the lecture, I'm able to go up to them and say, hey, can I shadow you? And so far, I've had some like lined up. So, it's like really, really helpful.
Yeah, exactly. So the faculty are great, and then also
Mm-hmm.
I think advising is also one of our strengths. We get like a list of people within our field that we can shadow, and then it's just up to you to reach out to them. And so it's very easy to get any opportunity that you want. There's a lot of people also doing research.
Mm-hmm.
So yeah, I think culture is very good overall on the student side and also on the faculty side.
Yeah, I agree. All right. Well, thank you so much for taking the time out to help me explain a little bit about the school and everything. And please let us know if you guys have any other questions about the school. We'll be happy to answer anything.
Yeah, good luck with your cycle, guys.
So I wanted to show you guys where you'll be learning at the school since we do share a building with Cian Hall and it can get kind of confusing. We are predominantly on the fourth floor, but we also have small group classes on the third floor. And now we're walking towards the learning studios where team-based learning takes place. As you'll see, there are tables with microphones and HDMI ports to plug in your computer and share with your team on the TVs. And now we are walking towards the amp where most of our large lectures are held. Now we're at the lower level of the building where you can find lockers you can store your stuff in, and also games such as pool, table tennis, air hockey, and more, which you can play with on your free time. There's also multiple student kitchens on different floors, including this one, where students can store and reheat their food. There is also a volleyball court outside on the lawn, and they are adding new soccer goals for soccer.